Welcome to the American Academy of Grief Counseling's videogram on dissociation. And dissociation is an extreme reaction to past trauma. And it is a serious complication that is usually associated with post-traumatic stress disorder. It is a subconscious coping mechanism that looks to help the individual when triggered to escape the trauma itself. And what it does is allow the individual to shut down or disconnect when triggers produce a particular flashback. Now, bear in mind with PTSD, the event or the trauma or the loss is so severe that it has not been able to be properly stored within the brain. They are fragmented, as it is said. So the whole event was so traumatic, was so terrifying in PTSD that the individual is never really able to process it fully, to integrate it and understand it. Hence, it is fragmented within the brain and it can be triggered through similar scents, sounds, or sights. And these triggers can cause what we refer to as dissociation. Dissociation can take place with what we refer to as detachment from reality. The detachment from reality can be a depersonalization, where the individual is breaking away from their personality almost to a point where they don't feel like they control themselves no longer, almost like they're a robot, so to speak. It can be from a form of derealization, where they disconnect from their physical surroundings itself, or it can be through dissociative amnesia, where they have a loss of recollection of that time frame itself. Now, with these type of symptoms of dissociation, many times individuals speak of feeling as through one is in a trance or a daydream. They have a hard time recalling what occurred during this particular episode. They have a sense of detachment from oneself or the environment, which is depersonalization or derealization. They feel a strong emotional numbness or feeling overwhelmed. And with that, a loss of control of emotions, and also a very much sensory disconnection, which is part of depersonalization as well, where there is impaired touch or vision itself. Now, obviously, this is very dangerous for the individual and other people that might be present, because an individual is no longer in touch with their sensory world, their reality. They're also no longer in touch with their conscious feelings. And they also have no recollection of what might be occurring. So they could very easily unintentionally harm someone or also harm themselves. So in various therapies, mental health care professionals try to help others, especially in this picture, you can see a case of a soldier, help an individual control themselves when disassociation occurs through various triggers. And it's all about finding grounding. Now, first and foremost, before the actual event occurs, there are a series of therapies that are cognitive behavioral in nature. These cognitive behavioral therapies, or CBT, look to intellectually discuss the trauma and to understand the trauma and how to reframe the trauma and how to walk through a particular incident that might occur. And this involves getting to the core of the problem, which has a lot of desensitizing therapies, which also involve uh, eye movements, rapid eye movements that help individuals witness. So this is a type of exposure therapy where an individual relates what happened. And in this way, they have a better ability to focus. Now, obviously, in counseling, exposure therapy can be very risky, and it should only be done by a licensed counselor, one who is trained in exposure therapy and desensitizing therapies. in helping individuals come to some sort of understanding of their particular trauma. Now, despite the cognitive therapies and the desensitizing, when dissociation does occur, it can be potentially dangerous, as we mentioned. So physical grounding is a type of cognitive therapy that is discussed, part of a process within cognitive therapy that is discussed of how the individual can react. And these can be physical, mental, or emotional. Now, physical grounding sometimes involves finding something to touch to allow yourself to remain within the reality, whether it's the side of a chair, whether it's rubbing your feet on the floor, grabbing a particular object. You're trying to remain anchored to reality. Mental and emotional grounding goes back to the cognitive therapies where it's discussed in how to deal mentally when something begins to slip away. And sometimes there could be certain phrases that are said in advance that are role played that can later be utilized when an event occurs, as well as emotional thoughts and feelings that can be invoked that can sometimes prevent the disassociation from becoming more drastic. Obviously, disassociation is triggered. It can come at the most inopportune time, even when someone is driving or in the middle of the city, walking in a public area. So it's important to get a grasp of this if you are struggling with PTSD and especially disassociation for the safety of others as well as yourself, and to have a fuller understanding of how grounding can help you with disassociation. AIHP offers a certification in grief counseling certification. Our link is below. Our number is 330-652-7776, and our email is info@aihcp.org. Remember, mental health is extremely important, and if you're suffering from more severe cases of mental health, you need to find the help that is out there so that you can get better. I'd like to thank you for listening and have a good day.